someone in my family's having a baby, and she's still sick today, and she's 7 months.
Yeah.
I mean, her whole pregnancy, she was nauseated. No more than 8 to 10 caps per day is what they say, and that's okay for pregnant women. Now, anxiety. We talked about this before, but people who are suffering from anxiety, they could take the following: passion flower, chamomile, hops. What did we say earlier hops does?
Produce sleep.
It induces sleep. And valerian. Now valerian can have an opposite effect on some people.
Yes.
It can actually make them wide awake. And I used to think that was weird when people would tell me this, that did them to them, because I was like, no, this is for sleeping. But then when I read and heard about it, so if you notice that some people, when you give them this formula, and they're like, oh man, I took it and it kept me up all night, remove the valerian.
Yes.
And then just give them the passion flower, the chamomile, and hops. Okay? Raspberries, red raspberries. Do you know how good and medicinal those are? Red raspberries. They are high in ellagic acid, which is supposed to be something very good. 59% reduction in endogenous DNA adduct, something that does the DNA that's dangerous. 59% is decreased when you eat red raspberries. She said if you want good DNA, eat raspberries. If you want healthy cells, eat raspberries.
They grew in my yard.
They do?
My mom's yard.
Oh, wow. She said 1 cup of fresh raspberries every day for a year is good for liver disease. Liver disease. So if you know someone suffering from liver disease, have them do 1 cup of red raspberries every day for a year. She said this will help the liver like nothing else. That's a long time to do raspberries, but it works. She said pomegranates as well are good for the liver.
So 1 cup of red raspberries for a year.
Yes, every day. Just have them included in their diet.
Heal the liver.
Yes, it will heal the liver. And it probably depends on how bad it is. That's probably for your severe.
Right.
Okay.
That's amazing.
We talked about this before. Curcumin. Remember where we find that ingredient? Say it.
Cinnamon?
No.
It was one of the spices.
Turmeric.
Yeah, turmeric, yes.
Curcumin is in the turmeric. It's good for inflammatory bowel disease, pancreatitis, and arthritis. Pancreatitis and arthritis, those are both inflammation. Pancreatitis is an inflammation of the pancreas. And arthritis, arth
if it
means
gets too big,
joints.
it could explode, right?
What?
The pancreas.
Absolutely. Itis, when you see the word itis on the end of the word, it equals inflammation. So pancreatitis, appendicitis, inflammation of the appendix.
Talk about that
Curcumin.
A lot of the top power lifters in the last year, they've been taking that to help the pain.
With the muscles.
Yeah.
Yes, absolutely.
Pain, arthritis, old injuries.
If you know anyone suffering from pain for cancer, do the castor oil packs and also the curcumin.
They've taken Vicodin. I mean, they're taking Vicodin Percocet.
And they're not taking that anymore? Thank you. Thank you.
Spell that Kerman again.
Curcumin. Curcumin.
I've actually taken it too.
It's the ingredient found in turmeric. Okay, wound healing. We're going to talk about wound healing. Guess what was the #1 ingredient used to heal wounds before penicillin came around? What did you say? Honey. Now yesterday I said don't worry about your fancy raw Manuka honey, because when you're trying to teach remedies, you want to be able to reach the poor as well as the rich. But, anyone heard of decubitus? These are ulcers, bed sores. You can get them on your ankles, especially they get it here. I have seen a decubitus on somebody's bottom area be this deep. And this would be all rotten flesh. And it smells really bad. What you do is, let's see, pressure ulcers produce the largest error cost at almost $3.9 billion per year. $3.9 billion dollars spent on decubitus.
So you use honey.
Table honey. They say Manuka honey, when you're dealing with the decubitus, is the best. You'll have the fastest healing.
Spell Manuka.
M-A-N-U-K-A. I believe that's how you spell it. It comes from a bush in Australia. You can also buy Manuka honey dressing changes. The dressings, to do the dressing change. And you want to change it frequently. They said they did comparison to the stuff they're using regularly in convalescent homes versus doing the Manuka honey. It said wound care first group had incidents of healing immediately, like quickly. They said there was a major notice between the group that does your average dressing change versus using the Manuka honey, and they said that it doesn't compare. Also use the Manuka honey on MRSA. Remember we were talking about that yesterday, and I told you about my friend that she got that big open gash, and now it's like this, she has a keloid about that big on her chest. Use the Manuka. If they get open infections, use the Manuka honey. It eradicates it. Have them eat it as well. It eradicates the MRSA. And what else did we say for MRSA? Garlic.
Oh yeah.
Medical science is saying the #1 remedy for MRSA is garlic. Let me see if I could tell you what MRSA, what it stands for. It's a staph infection. But I just want to give you the name. MRSA. They don't have it in here. No, they don't have it abbreviated. Let me see if it's in this book. Just one moment. No, it's not in here. I'll get the name for next time. I'll let you guys know. So for wounds, any kind of wounds, use the honey. And especially when you're dealing with decubituses, which are bed sores, bed ulcers, that's a decubitus. You have 4 stages. You know, they say if you don't use it, you lose it. But let me see if I remember. First stage is redness. Especially in this area, like when we go, and when I have to go to the homes and check on people in 45 minutes if they were bedridden, I have to roll them over and look at their backside. I have to look at their ankles. I have to look at the shoulders. These are pressure points that tend to break down sooner than any other area of the body. And if you're dealing with anybody who's bedridden and they're not having spinal issues, you want to do what's called a log roll every 2 hours. You want to move them. You move them on this side, their left side. You roll up a towel, you stick it under their back. It'll keep them from rolling over. Then you lay them 2 hours on their back side. Then you roll up 2 hours on this side. You want to switch them every 2 hours. And you want to put things underneath their ankles. And this will keep them from getting these sores. Okay, I think this is a tear. I don't remember, but I know step number 4 is like, it's dead material, dead skin. It's like the lady I was telling you, that's stage 4, and that's a really bad stage. You don't want it to get that far. The moment you see them having redness in these areas, you want to rub, massage the area, get blood to the area, and move them. You don't really need the honey until you have broken skin. When you see the redness, gently massage and get circulation to that area. Okay. In case of infections, they say have a spare diet, but you do need protein. When you have an infection, we just learned this yesterday. I didn't bring the book, or Friday, in school. The amino acids. We learned that there's 21 amino acids. But there's 8 to 9 what are called essential amino acids, which means your body doesn't make those. You have to get them from your foods. One of the purpose of these amino acids is to produce healing when you have infection. Some kind of skin tearage, some kind of damage, infection in the skin, in the body, the flesh. And the amino acids, so where do the amino acids come from? What did we say? Protein. You need protein to get amino acids. So people who have infections, if they have wounds, open sores, cellulitis, anything affecting the skin, make sure, if they're a vegetarian, 100% plant-based, make sure they're getting their protein, because a lot of vegetarians, they do not properly combine their food and they don't know what to eat. So they'll just eat pasta all day, or they'll just eat fruit and vegetables all day, but they're not getting any beans or tofu. Or we want to make sure there's protein in the diet. Echinacea and elderberry can be used in pregnancy for infection. Echinacea and elderberry. But you don't want to use it continuously. You want to have periods where you stop. So echinacea and elderberry. Tinnitus. Does anyone know what tinnitus is? Do you know what that is?
Something like on the shoulder, like right here at the elbow. Isn't that like a arthritis type thing?
I don't know why I'm thinking this is ringing in the ears.
Huh.
I'm more than positive this is ringing in the ears.
Tendinitis.
Yeah, this is ringing in the ears. I'm not going to make sure though. You know, they say you don't lose it, you don't use it, you lose it, but I'm more than positive tinnitus is the ringing in the ears. Do you know aspirin and Tylenol and ibuprofen can cause the ringing in the ears? This is what they say to do. Increase the manganese. I didn't bring the first volume. I wanted to tell you what foods are high. Let me see if I can look in here for tinnitus. Manganese. Let me look for the foods high in manganese. It's in volume 1. I'll let you guys know next time. But foods high in manganese, it helps the ringing. Oh yes, it is ringing in the air. It helps the ringing in the air. Light in the morning, getting that morning sunshine, can help stop the ringing in the ears. I thought, wow, that's amazing. Sunshine. Antioxidants can help the ringing in the ears. Do you eat red grapes? I do when they're not expensive. They're $3 a pound right now.
Yeah, and they're not in season.
Do you chew the seeds?
Yes.
I chew the seeds. Do you know those are high in antioxidants? They're very high in antioxidants. Lemon is high in antioxidants. Oranges are high in antioxidants. Yes, sweetheart?
Are black grapes high in antioxidants?
I'm imagining they are. Grapes are high in antioxidants, yes.